For the vast majority of women, the rate limiting step to getting pregnant as we get older is actually the quality of the eggs. And this becomes harder as you're older. And we do see a substantial drop off at age 38 and beyond.
I was thinking about how do I not get pregnant? Because I was a lawyer, I wanted to make partnerships. And you spend all your time thinking about that. And then suddenly when you decide I want to get pregnant, you're like, well, why aren't I pregnant?
You're trying to catch up on all these years that you didn't learn about your body. Egg freezing keeps a door of opportunity open longer, whereas nature starts to close it. Is egg freezing a guarantee? It's not.
What's becoming like more and more apparent from the research is this link between ovarian aging and the aging of a woman's body as a whole.
Your body's all connected. It's not, oh, do this to get pregnant, then do this to have your ovaries work longer, and then do this to have success in perimenopause. It's the same thing. It is all looking at decreasing inflammation, decreasing insulin resistance, and building up resilience inside your cellular health.
Dr. Crawford, it is so great to have you here today. Really excited to speak to you about fertility and ovarian aging. Welcome to the show.
Thank you so much for having me. I'm honored to be here.
So let's kick off with a couple of questions that I've got from my community. Some of them may be misconceptions, but kind of common things that I think women have around their mind that they worry about in relation to fertility.
Okay.
The first one is it true that a woman's fertility is effectively halved every single year after she turns 32?
It's not halved, no.
It's not halved. Okay. Is egg freezing a guaranteed insurance policy for having a baby later in life?
No.
No. We're going to dive deep on these. Can the hormones that are used for egg freezing increase a woman's risk of developing postnatal depression further down the line?
No.
And is it possible that by finding a way to delay ovarian aging, we could actually help everyone, including men, live longer, healthier lives?
Yes.
For a woman over 38, is it true that she might need to freeze 20 or more eggs just to have a reasonable chance of having one child?
Yes.
Okay. And the last question is the ovary the fastest aging organ in the entire human body?
Oh, that's a great question. Depends how you define it. We'll have to go into more detail on that one.
I think what's so interesting about kind of the questions that I'm receiving and this topic is, I guess we've understood for some time that we need to think about a woman's biological clock, if you like, and when she times her family. But what's becoming like more and more apparent from the research is this link between our ovarian aging and the aging of a woman's body as a whole, right? And how health protective it can be. And so I'm really keen to sort of dive into both those areas with you in this episode. When we're looking at fertility, I think if we kind of kick off there and we look at the aging of a woman, a lot of women start to, they're building their careers in their 20s quite often, and starting a family isn't always the focus. So they may be deliberately delaying it, or they may just not have found the right partner or be in the right relationship at that point. What is the stage at which they need to really start thinking about something like freezing their eggs?
That's such a great question. And you've hit the nail on the head. We are seeing a generation of women who are not finding partners as early, are chasing amazing, incredible career goals, and are starting for a family later. I always say, hey, the time you should start considering learning more about your fertility or freezing your eggs is the moment you're asking the question, because we know the younger you are, the more eggs you have, the better quality they are, the better outcomes you might have if you're considering things like egg freezing. The more scientific answer is going to be based on studies looking at cost effectiveness and relative rate of success. If you are approaching your early 30s, so between 32, 33, you are not ready to start a family, whatever that means for you, it is a great time to freeze your eggs where you are likely to have a good return on that investment. Does that mean we don't see benefit to women freezing later? No, absolutely not. I've had women freeze eggs up into their 40s and still have a baby from them. But we are looking at how much you're going to have to spend, how many cycles you're going to have to do, the odds of using those eggs. So I think that's a good benchmark. If you're approaching 31, 32, you want a child as a life goal and you're not in a position where you're ready to pursue that. Consider getting your ovarian reserve tested, talk to a fertility doctor, learn more about egg freezing. There's not going to be a one-size-fits-all approach, but one thing that I love is the idea that you need to make decisions based on you. You can choose to do whatever you want, but if you're making a decision without your own body's data and based on perception instead of reality, right? Get the data, learn about it. And then you might say, hey, egg freezing's not for me and I'm okay however this goes. You might say, gosh, I should freeze my eggs. I've also had patients who are in a committed relationship, just not ready, who've found information out that has totally changed their family plan. So it's hard to think about all the different scenarios you might do. But for so many people, this is a huge life goal that I do think we've done a disservice. And I fell into this camp too, of this idea of let's just prevent pregnancy as our primary goal and not even think about our fertility until the moment you're ready to conceive. Like any life goal, I think it's important to start talking about it and thinking about it earlier so that we can be more proactive in our approach.
Yeah, I agree with that. And I think the thing is, what I noticed is when I was going through that phase, is I was building my career and I wasn't focused. I was actually, as you say there, I was thinking about how do I not get pregnant,
Yes.
right? Because I
Like,
was a lawyer,
please,
I wanted to
no.
make partnership. And you spend all your time thinking about that. And then suddenly when you decide I want to get pregnant, you're like, well, why aren't I pregnant? Like immediately
It's why aren't
almost.
I pregnant? You're trying to catch up on all these years that you didn't learn about your body. I think we've just done such a disservice because suddenly, like, why am I not pregnant? Am I ovulating? How do I know if I'm ovulating? How do I track my cycle? How long is too long? What should I be doing to increase my odds of success? And all these questions that we start looking into or answering for ourselves way later because that's just what we've been accustomed to. And I love that conversations like this are switching that narrative where we can start saying, hey, if you want kids one day, what should we start doing earlier? What should we think about? How can we prepare ourselves so that we have a higher odds of success of achieving this goal, even if at the moment of our peak reproductive years, we're not quite ready for a kid yet?
Yeah, I love that. And I want to kind of dive back a little bit into that in terms of like deeper optimization, what women should be looking at. But just sort of sticking with the question around freezing your eggs, what about, say, the mum who has she's had a baby, or maybe at 28, 30, she's not ready to have her second one? Should she be thinking about freezing her eggs if she's delaying it by a few years, having a second child, or does that change things if she's already had a baby?
If you've already had a baby, you have a higher probability of getting pregnant per month if you're trying with the same partner in the future than somebody who's never tried. And that's simply because, based on studies, certain parts are working, right? We know certain things. You could ovulate, sperm could fertilize an egg, your tubes were open. But the thing is, that's going to personalize this question, how many kids do you want? Because the 32-year-old who has a baby who wants just one more kid is in a very different position than the 32-year-old who had a baby who wants three more children. So, your total family size, the length of time you desire to space your kids out. A great example is I saw a patient yesterday and she is pregnant with her second child. She previously froze her eggs, currently 35. These two kids, she got pregnant naturally and they're very close in age. They will be, two under two. And she knows I want another kid, zero doubt, but I need to put some space between it. It's going to take me 3+ years to be in a position where I want to approach that. And so, because she froze her eggs when she was younger, we're now making them into embryos, making sure we have what we need. Because if we don't have enough normal embryos, she's going to go through another cycle in this postpartum period when she's postpartum because she wants that opportunity to delay. Egg freezing keeps a door of opportunity open longer, whereas nature starts to close it. And again, it's all about risk tolerance. So earlier you asked me about, is egg freezing a guarantee? And it's not. And I see a lot of people call egg freezing an insurance policy for your fertility. They say, hey, if you want to have kids later and you're not ready, go freeze your eggs so that you can do this later. It's an investment like investing in the stock market. Is it smart? Does it usually pay off? But is there risk involved? And you have to decide what risk tolerance you have. Absolutely. It's an investment in yourself. And if we view it through that lens, the more eggs you have and the younger you are when you're putting them into storage, the greater ROI you're going to get. Similarly, if you want more kids, more eggs, or you might want some eggs if you want to wait. This is why these scenarios are so individualized and personal that it's really hard for a human, a person, to just know what to do, or for me to just give one way advice. If your egg count is lower, you might want to freeze eggs earlier. If your partner is older, because men do go through a male menopause, they do stop producing sperm, but also their sperm quality does dramatically change as they get older. And that can be associated with higher rates of neurodevelopmental outcomes in children, like autism, can be associated with certain specific genetic disorders called imprinting diseases. And typically, this is age 50 and above for man. But if you say, hey, my partner's older, and by the time we want to have this next kid, he'll be even older, there's so many unique scenarios where it might make sense if it's very important to you to have a certain family size or to have more kids. Then my basic recommendation is it is always smart to get more data. You can see a fertility doctor. You're not going to be pressured into anything. You can find out where you are on what we call ovarian aging, how many eggs you have left. Your partner can get a semen analysis, and you can talk through your specific odds based on your specific goals. And I'll say one of the first questions I always ask patients is, well, what is your goal? And I say, if your life could be perfect, which we all know it's not, how many kids do you have? How far apart are they in age? What would this look like if we could write the story of your life? Because you deserve to know what statistics might say about that. And then you can make the best choice for yourself.
It's very interesting what you shared there. So the patient that you were describing yesterday, it sounded like she had frozen her eggs, but then conceived two children naturally close together, right? So then she still had these eggs frozen. And then in terms of delaying, because actually that was the exact position I found myself in, was with two children under two, but I knew I hadn't completed my family. I wasn't ready at that point to go on to have a third. I had, and unexpected things, like you say, can happen. Like I struggle with postpartum depression really badly. So I had to get over that, right? And that causes delays. We can maybe talk more about that in a moment. But actually, it's quite nice then if you have some eggs frozen from when you were younger, you don't feel so pressured. Because I remember that pressure thinking, it was 33, I think, when I had my second. Oh, do I need to speed this up quicker than my body feels ready?
It's hard to imagine what you're going to feel like in the future. And I think it's one of the biggest things, right? So often we think, oh, once I have a baby, I'm going to feel a different way. Pregnancy is challenging. Postpartum is one of the hardest transitions you're going to go through. I had two kids under two. It is rough. And so I think that if you're somebody who's wanting a bigger family size, there's greater odds you're going to need them because of how old you might be getting, depending on when you're starting. But also, it does give you some freedom, some flexibility, some when you've gone through worry, if you've worried about can I get pregnant, obsessing about if you're doing the right thing, being able to say, gosh, I don't have to start trying right away. Oh, I have these eggs. Oh, this is an opportunity for me. That can change your mental health and your outlook and your perspective so substantially. So, even though something may not be a guarantee, it can keep opportunity open and be so valuable to your mental health, to your family plan. And right now, we are living in the era where a lot of women are getting insurance coverage or they might have work benefits. And that's one thing I always want to say is that if you have a work benefit that does cover some fertility treatments, please at least go learn about it because you don't work benefits change. You may not have that next year. You should go and investigate this because it could change the entire, you know, kind of journey that you're taking to have some eggs in the freezer, depending on your goals.
It sounds like, from what you're saying, it gives peace of mind. If we look at when somebody thinks about freezing their eggs, what is the process that they would need to go through? I think many women worry about maybe how much that's going to stimulate their hormones, what effects that might have. What have they got to think about going into that?
So, the first thing you're going to do if you're going to get your eggs tested, you'll have a consult with a fertility doctor and you're going to find out your ovarian reserve, which is typically a vaginal ultrasound and some blood work. So, nothing super invasive, although vaginal ultrasounds are never very fun. This is going to allow us to determine the protocol or the combination of medications that it's going to require to get your eggs to grow. The simplest way to describe this is to imagine that inside your ovary is a vault where all your eggs are kept. You're born with all the eggs you're ever going to have. And every month, a group of eggs comes out of this vault. Now, from this group, one naturally would ovulate and the rest would die. But the size of the group, the number of eggs that come out of the vault every month, that is in proportion to how many are left behind. So, in general, when you're younger and the vault is more full, more eggs come out every month. And as you get older, fewer eggs come out of the vault every month. So, we can count the eggs outside the vault. That's what we do on ultrasound. Or we can check a blood test called AMH, anti Mullerian hormone, which is made from the cells that surround all of the follicles outside the vault. And that kind of gives us a surrogate marker for, well, how many are left on the inside if this is what we have on the outside? And it's very simplest. Egg freezing is trying to get all the eggs outside the vault to grow. So I'm not going to tap into the vault. You're not going to harm your future fertility. You're not going to run out of eggs any faster. I am just saying for this 1 month in time, instead of letting everything but one die, I'm going to try to get more of them to grow. And similarly, you can overcome being older or having fewer eggs by doing multiple cycles. So I could get all the eggs from 1 month, and then I could do it again next month and try to get a higher number. In your body, month to month, if you're not on any hormonal contraception, the brain sends out a hormone called FSH, or follicle stimulating hormone. FSH gets an egg to grow. And there's this delicate balance between the brain and the ovary, these checks and balances, because your body only wants to have one egg, one pregnancy at a time. However, if you're 30, for example, we might be able to get 20 eggs from you. You might have 20 eggs outside the vault. Your body doesn't want to have 20 babies at one time. So the brain and ovary don't want to allow all 20 to grow. That's how it protects you from having a 20 gestation. Well, we have to break up this brain ovary communication and override the system. Many women falsely believe that for IVF, we're giving you these weird, crazy medications, or it's artificial or something that's strange. The bulk of the medication that you're taking is high doses of FSH, synthetic hormone made in a lab that's the exact same structural compound as the FSH made from your brain. Extremely short acting. It has to be given by injection because it is so short acting. And that usually lasts for less than 12 weeks. So think about I'm giving your body more FSH than you would ever naturally make. The other thing we do is combine it with some form of an ovulation blocker, because as eggs grow, they make estrogen, and estrogen usually comes back to the brain to tell the brain to ovulate, and we don't want to ovulate prematurely. And so these are just hormones that are blocking LH from the brain in some way. So these are things that your body kind of naturally does. They're just interfering with the normal hormone process. Very short acting meds. They're out of your body in under 24 hours. And they're very specific and they're expensive, unfortunately. But it's 2 weeks of medications to get the eggs to grow. And that's the time frame when you're actually coming in for appointments, typically every couple of days, which would include a vaginal ultrasound and an estrogen blood level so that we can measure the eggs as they're growing, check your estrogen, titrate and adjust medications. We're trying to get as many eggs in the mature range as possible. So there's some variation there. So I always say it's about a month to get all your ducks in a row, get your initial testing done, get your protocol. And then it's typically 2 weeks of hormone stimulation, which is much faster than most women believe it will be. And then at the end of this, you're going to have an egg retrieval procedure. And the egg retrieval is the most invasive part of the process, although it is a minimally invasive procedure. It's done under IV anesthesia. So you'll get an IV. We have an anesthesiologist. It's conscious sedation, like a colonoscopy would be. So no breathing tube, minimal risk that you don't remember, which is really nice because it's a large needle that actually gets attached to the vaginal ultrasound. And we go vaginally right into where the ovaries are. So we just enter each follicle, drain that follicle, and get the follicular fluid in the egg into test tubes, send those off to the lab, and then they identify the eggs and they freeze them that day. So the same day the eggs are frozen, you will get a period, typically about a week to a week and a half after the egg retrieval. And then things will go back to normal. So if you were on contraception before, you can continue it. If you weren't, your period will come and then you'll ovulate the next month. If you're trying to do back to back cycles, we easily can do that. And you even can do egg freezing with an IUD in place. So if you have an IUD and that's a really effective form of contraception for you, we don't have to remove that to do the procedure. It can stay in the whole time. So most women are surprised by how fast the actual procedure is, how fewer appointments or time of their life it was actually taking them. The setup does take a little bit of time, meaning coming in, initial testing, knowing the protocol. So sometimes I'll see somebody, she's like, I want to start freezing my eggs, this week. That's highly unrealistic. So making sure that you're scheduling an appointment, a couple months before you're actually looking to go through the procedure is really important as well.
I had no idea it was that simple and that kind of quick. I mean, would you say that a woman doing this can continue to work as normal during that process? Like, how would she expect to feel with the additional hormones she's getting and things like that?
Fabulous question. The response is going to be very different based on how many eggs you have, meaning each egg makes estrogen, each egg is going to grow. So, somebody who's going to have, let's say, 8 eggs and somebody who's going to have 25 eggs will have extremely different experiences. The woman with 25 eggs will have a higher estrogen level. She will feel more bloated. She will feel more pelvic pressure than the woman who has 8 eggs, who is not going to notice a huge change from what she experiences month to month. On the pro, that makes it easier for women who have fewer eggs to go through multiple cycles. The higher your egg count, the more you may feel these hormonal highs and lows. The vast majority of my patients work all the way through their stimulation, meaning they're using hormone shots at home, they're coming in for ultrasound, they're going to work, doing their normal job, taking off the day of the egg retrieval because they are getting anesthesia, and then usually taking off the next day or trying to work from home. You'll probably feel fine, but you are having a hormone crash. We have to admit your estrogen's probably one of the highest it's ever been because we go into each follicle and destroy these cells. It's going to drop off pretty profoundly. What I find most women surprises is that the actual stimulation, I'm giving myself shots, I'm coming in for monitoring, my follicles are growing, my estrogen's rising. Most people feel pretty good during that. I mean, yeah, you might feel bloated or pelvic pressure, but high estrogen for the vast majority of people feels pretty good. You don't have, mood issues or other things that we might associate or expect to have. But it's the week after the process when your estrogen just went from the highest it's ever going to be and then it drops pretty quickly that you're actually more likely to have mood instability. And so that's one thing that I warn my patients about is that, hey, don't plan that big work presentation, immediately after your egg retrieval or that big conference. Even though that's what we might be thinking, you will probably feel less good during that week after the retrieval, even though you can still work. Physically, you'll feel okay. You're going to feel that hormone crash. So if you get PMS, if you have ever had that before and you kind of know what that hormone crash feels like, that's the time period that I work warn my patients about much more than the I'm actually giving myself the shots and coming in for the appointments that we're pretty resilient against, actually.
I want to take a quick break from this episode to thank our sponsor, Level Up Health. They just created a brand new formula I'm so excited to share with you. If you're in your 30s, 40s, or 50s, chances are you've felt the ripple effects of shifting hormones. Maybe it shows up as perimenopause symptoms, heavy periods, hot flashes, mood swings, or sleep struggles. Maybe it's stubborn weight gain that just won't budge no matter what you try. Or maybe it's PCOS, acne, or that bone deep fatigue that keeps you from feeling like yourself. Here's the truth. When your hormones are out of balance, every part of your body feels it, and it's not your fault. It's biology. That's why I'm loving their brand new comprehensive formula, Hormone Harmony, designed specifically to bring hormones back into balance. This advanced blend combines nutrient cofactors, adaptogens, and clinically studied actives to target the root causes of dysfunction, not just the symptoms. Hormone Harmony is built to support endocrine resilience, metabolic health, and inflammation balance, especially in the context of estrogen dominance, androgen imbalance, and cycle irregularity. It works across multiple pathways at once, supporting detoxification so your body can clear excess estrogen, improving insulin sensitivity to help regulate blood sugar and hormonal weight gain, reducing stress and calming cortisol to restore adrenal balance, nourishing mitochondrial health for steady energy and resilience. Most supplements focus on one piece of the puzzle. Hormone Harmony is different. It's a complete system designed to shift your hormones from chaos to harmony. And when that happens, your energy, your mood, your focus, and your confidence all come back online. So if you've been searching for something that finally connects the dots, Hormone Harmony makes it easy. Head over to leveluphealth.com and use code Angela15 at checkout to get 15% off your order site-wide. Again, that's LVLUPHEALTH.com and use code Angela15 to save 15% off. You can also find the link and code in the show notes.
It's actually the bit after. I mean, when that estrogen's dropping in the way you're describing, would the symptoms be as dramatic as, say, a woman who's in the very late stages of perimenopause? Would you expect to get hot flushes, things like that? Or it's more that you might just get that kind of PMS style symptoms, a bit of irritability?
It's not quite like perimenopause because you still have estrogen in your body. So it is more like a severe PMS, or if you've ever postpartum is a great example where your hormones went from really high and then they kind of crash after pregnancy and you feel, depressed and irritable, difficulty concentrating, and just overall crummy, right? I mean, I don't want to minimize it because it can be quite profound. The good thing is that it is short lived because your natural, ovulation system is going to kick back in. So it's a temporary moment, but I do think it's worth bringing up to people because it can, be impactful to your life. I think if you said you had postpartum depression, and so you know that those hormone changes can be very impactful for your mental health.
100%. How would this be affected by a woman who has PCOS?
So, a woman with PCOS tends to have more eggs in general. So, you tend to have a higher egg count. That is often a superpower when it comes to egg freezing because you tend to be able to get more eggs per cycle. I always say it's really important for women with PCOS to focus on factors for egg quality because they do tend to have metabolic changes like insulin resistance and inflammation. So we want to make sure we're mitigating those so that we still have good egg quality. But if you have more eggs, you're going to have higher estrogen. You are going to potentially feel more bloated, more pressure. And so you might have more, greater highs, lower lows. And so just anybody who has a high egg count, and PCOS patients tend to fit into this gap. I always want them to know, hey, you're at risk for something also called ovarian hyperstimulation syndrome or OHSS. And we have protocols now medically where this is actually quite rare, but this is where when your body is making a lot of estrogen, too high estrogen levels can be detrimental. In ovarian hyperstimulation syndrome, which again, we've changed protocols. We have newer medications. We're not doing very many fresh embryo transfers for women who are trying to get pregnant, which are all risk factors for OHSS. Your estrogen's high and stays high, and prolonged super elevated estrogen actually can destabilize some of the blood vessels. The easiest way to say this is that some of the liquid, the water component of the blood, migrates out of the blood vessels, depositing in the abdomen and the lungs. And you can get ascites, fluid in the abdomen, or you can get pleural effusions, fluid in the lungs. Those can get infected, which is obviously very detrimental to your health. But your blood is thick. So it's one of those circumstances where you're dehydrated, but if you're drinking water, it's just leaving your blood vessels. So that can lead to kidney damage and an increased risk for blood clots. OHSS used to be a really big problem in the IVF world. Women would be hospitalized for weeks. It made it very difficult for women with PCOS or high egg counts to undergo IVF because often their estrogen would rise prematurely. They would be triggered or taken to egg retrieval too early, and a lot of their eggs were immature. I'll give one example here. I saw a patient who previously tried to undergo egg freezing in Japan, and she was very young and she had PCOS. And she was in Japan. They weren't using the modern protocols that I'm describing, and her estrogen levels rose really high. She went to egg retrieval. She had 40 eggs retrieved. They were all immature, which meant she couldn't use any of them. And she was in the hospital for 4 weeks because of her OHSS. I mean, that's crazy. We do not see that anymore, but that is what we did see 20 years ago with IVF quite commonly and was a big problem. When she came here and I saw her, she said, I do not want to do IVF. It's too scary. I can't do that again. And when I looked through her chart, I said, this will not happen to you if we use the appropriate protocol. And we went through IVF and we used a protocol that's appropriate to prevent OHSS is the easiest way to describe it. And we got 62 mature eggs from her. She did not get sick. She went back to work 2 days later and did fine. So the importance is just knowing if this is you, right? How does she advocate and prevent this from happening if, she was in Japan or if you're seeing a doctor? If you have a very high egg count or you have PCOS, I would simply say, ask your doctor if you're wanting to freeze your eggs or go through IVF. Say, how are we going to make sure that I do not develop OHSS? And they should be telling you, we are choosing a protocol that this will not happen. And they should be able to give you a list of reasons why, including the trigger medication they're using, kind of the protocol, a variety of different things. And there's some medications afterward that can kind of help estrogen drop a little bit faster for these patients. So this is just long-winded to say that rightfully, some women with PCOS are very fearful of freezing their eggs. They hear these stories, like my patient, what she went through in Japan. They say, I can't be in the hospital for 4 weeks. And it becomes very scary for them. But the truth is, in good hands, OHSS should really not happen. And freezing your eggs shouldn't be that impactful on your life, which is a wonderful thing if you're trying to look at keeping that door of opportunity open.
So just so I have this kind of clear for just to summarize, because there's quite a lot of detail there for people. Because I, for one, actually, having had PCOS and endometriosis, I didn't realize until I listened to you, I think, on Diary of a CEO, that women with PCOS had a higher egg count. So that actually was new to me. But when we're looking at this situation, so we're talking about when we're freezing our eggs, what we're taking is the eggs out of the vault. So these are the eggs that were going to come out anyway that month. We're not actually stimulating more eggs, right?
Correct. These eggs were already released from the vault naturally. We're not tapping into the vault. We're just giving them more stimulus to grow instead of having them die.
And then taking them away. Okay. So when we look at then for a woman who she may or may not have frozen her eggs at this point, but she wants to understand what is a realistic time frame for me to try to get pregnant. I never like that word because I almost feel like that word in itself applies pressure to so many women. But if she's looking to conceive, what is a realistic timescale for her to say, okay, this isn't happening sort of fast enough. And I need to either take steps to freeze my eggs or start looking into alternative things, or if I have those frozen, to use them.
There's the medical definition of infertility, and then there's what I think is more appropriate in real life. Infertility is defined as the failure to get pregnant after 12 months of trying. So you do not carry an infertility diagnosis till you get to that moment in time. Because it is harder to get pregnant as you get older, we kind of shorten that time frame to 6 months if you're over age 35. But even for women who are under age 35, 72% of them should be pregnant in the first 6 months of trying, and only 13% are going to get pregnant in the next 6 months. So I always frame, are we willing to wait an additional 6 months to just get a 13% chance of success? For me, that means that, after 6 months of attempt, you're starting to fall into a smaller group where there's a higher odds that something is wrong with you. And I personally, I'd love to see patients before they start trying. Do initial testing. That's not the current norm. That would be my preference. On a greater scale, if you are trying to get pregnant and it's been 6 months and you're not pregnant, I think it's a very appropriate time to go see a fertility doctor for testing. And this would mean a semen analysis, an evaluation of your anatomy, checking ovarian reserve, talking to your medical history. If everything's normal, you might say, okay, great, I don't have infertility. I'm going to go try for a little bit longer. But if we're not pregnant by this time interval, we're going to get into treatment faster because I know these factors. Similarly, if you find something wrong, why are we wasting an additional 6 months? We're getting into treatment a little bit faster. We're starting to make changes to modify whatever may be happening. So I think that there's this traditional medical answer, which would be 12 months. I think based on probability and an increasing rate of infertility, I don't really love seeing women try longer than 6 months before at least doing testing. Doesn't mean they have to do treatment, but at least getting some data. I think it's very appropriate to do testing first if you're just interested in learning about your body. And I must say that this whole presumption on infertility is making the case that you are ovulating and you're having regular intercourse. So if intercourse is painful, if your partner can't achieve or maintain an erection, if your periods are not regular, if you can't detect when you're ovulating, if your periods are extremely painful, if you're bleeding through your clothes, these are all not normal things that society's normalized because there's so much stigma to women's health and we don't talk about our cycles. We get gaslit as women, we get dismissed. So we just assume what we're experiencing is normal. And I think it's really important to say that those are do not pass go moments, meaning go get an evaluation first. Your body is telling you that something's wrong and you're not fitting into that normal demographic group that has that higher odds of getting pregnant. It is heartbreaking to me to see couples who try to get pregnant for 2 or 3 years before they come see me and somebody's having extremely irregular cycles. They didn't have very many opportunities to get pregnant, or they were really struggling with intercourse because it was painful or because of erection issues. Yet they were told by a doctor, even, well, you can't have testing done until you've tried for a year. It is just not the right approach, especially as we do see the rate of infertility rising. We should be supportive of patients wanting to be more proactive.
For sure. And what's really interesting, Dr. Crawford, is when I interviewed Dr. Sarah Hill, the scientist who's done a lot of research, what she found is that when she was bringing women, healthy women in their 20s into the lab, and her colleagues have found a similar thing, is 30% of the time those women were not ovulating, which is kind of quite a scary
Yes.
stat in a way, because out of 6 months, maybe 2 months, you're not ovulating.
I know Sarah well and I like her work so much. And One thing that I think is a failure of this whole process is that very often the question asked is, do you have regular periods? Which is for many women very subjective. Oh, I think my period comes every month ish. You're not necessarily tracking it. Or even if you are tracking it, you're just putting cycle day one into an app and you're not actually tracking if you're ovulating with any of these physiologic signs. Like, are you getting an LH surge? Do you have cervical mucus? Is your temperature rising? And so, even women who are ovulating can have ovulatory dysfunction. The first stage of a problem ovulating is a short luteal phase. The luteal phase is the time period after ovulation. But you have to know when you're ovulating to know how long your luteal phase is. So if you're just marking cycle day one now, you're actually missing the first warning sign your body's going to give you that you might have an ovulatory problem. So, and that can make it a lot harder for you on different mechanisms because then your body's going to only get worse because you're not intervening sooner, or you might present with pregnancy loss or difficulties with progesterone production. So I think it's something that we're not really empowering women well enough to say, your cycle is a vital sign, and learning to track ovulation, not just knowing that your period's coming, not just saying, is your period heavy? Is it light? Is it painful? Those are very important questions. But actually knowing when ovulation's occurring to understand the different phases of your cycle, your body gives you a lot of information with that we just haven't learned how to tap into. And so trying to help women learn that ideally before you even want to get pregnant. So you could say, hey, my luteal phase is really short. We want to get pregnant next year. I should go see the doctor now to get evaluated to see, could it be my thyroid? Could it be prolactin? Is there something else going on that I need to fix so that I have a higher chance of getting pregnant?
So people can investigate it much, much earlier. I think the thing is, isn't it? I'm so glad that like you're bringing so much awareness to it, because I remember when I was, going through this stage, actually you just didn't address it until it was a problem. That was the thing. Even as a teenager, I remember being prescribed birth control because it was kind of like, we'll investigate later why you don't have a regular cycle. And then when you decide to have a family and you're like, I haven't had a period in a year, like there's no way of falling pregnant, then it starts to, I think, make women anxious. So I love that you are really recommending that they take control and they observe these changes and get help early. A kind of question that stems from that then is the switchover between freezing your eggs to use later and when actually it's like, no, now is time to actually go through an IVF cycle if you haven't done that, or if you have frozen your eggs, to start going through that process. Because when we look at the female body, is there a point at which it's like, actually, you should be, if you want to have a child, you should do this now? So is that in her early 40s, or does a point come when we need to switch over?
This is going to be more of a social recommendation than other factors. And this has changed over the years. So, egg freezing was experimental until about 2013 to 2015, depending on which institution you were at, which meant that the techniques were older, they weren't as good. And a slow freeze technique that we used to use, only about 40 to 50% of eggs would survive the freeze thaw. So, imagine going through this process, many eggs wouldn't survive. We know that not every egg will fertilize, make it to an embryo, be genetically normal, or implant, right? So there's a lot of attrition or loss along the way. Because of this failure of the egg freezing process when it was early, or this limitation, we used to recommend that women who were older considered getting donor sperm or making them into embryos if they had a partner, because embryos are so much more stable. They survive the freeze thaw really well. Wonderfully for us, technology has improved immensely. And now, in a good lab, the national rate of egg freezing, we're going to have 90% survival. In our lab, over 95% of eggs are going to survive the freeze thaw, which has really expanded this to make us feel more comfortable freezing eggs as women get older. Now, this doesn't mean that we have all the data. One of the biggest pieces of the puzzle is, how are they going to do in the lab? What percent will fertilize? How many will make it to an implantation embryo? How many actually will be normal for you? And we can use averages to give us an estimation, but by definition, average means some people do better and some people do worse. So it's going to depend. Although some of the most heartbreaking stories I've ever had, Angela, are patients who made embryos with a partner. One that I still keep in touch with today is, she had breast cancer. So she had to undergo emergent treatment before her chemotherapy started, because 20% of patients after breast cancer treatment will be in menopause, regardless of their age. And so she was married and we made embryos. And yet, after going through cancer, when she got to the point and she was ready to use them, they ended up getting divorced. And per their agreement, their embryos had to be discarded if they got divorced. And when she came to see me, she was now an ovarian failure and didn't have any eggs left. So she really regretted that her one moment where we could have frozen them as eggs, that she didn't do that. And I think this just speaks to the fact that we make the best decisions we can at the time period we're in, but that wrapping your genetics up with another person should be done with extreme caution for women, because your biological clock is different than a man's. And I tell patients all the time, life is dynamic, and it's not just, oh, we get divorced. I mean, people die, people get sick, things change. And so if we are doing something to preserve your fertility and keep it open, eggs give you so much more opportunity with that. And I have a lot of young women now who maybe are married. I see a ton of women who are married. This is the person they want to have a family with, but they are not anywhere near ready for a family. So maybe they're in their early 30s. They both have 5+ years that they are chasing these career dreams, and they are saying, what should we do? And I always say, this is a great opportunity if you have the means and the resources to do a round of eggs and a round of embryos, because this allows us to get the data from the embryos to know what's happening on the back end. But it'll keep some as eggs for you in the freezer in case life changes between now and when you're ready to use them. So it's a nuanced point. We know that if we're making them into embryos, we want to have at least 2 to 3 genetically normal embryos for every child you have. If you have 3 genetically normal embryos, you have a 95% chance of having a child from them. 2 genetically normal embryos is an 85%. 1 is a 65%. So this means the longer you're going to wait to find out, the more normal embryos you need to feel better that this is going to pay off for you. But of course, a single egg has about a 4 to 5% chance of turning into that embryo. So that's why we say, oh, the older you are, you're going to need more because of genetics and other factors. So there's a lot of assumption made when we're leaving them as eggs versus if we make them into embryos, we get that end data point. That said, regardless of your age, regardless of some of this data, for the same dollars, I could do 2 rounds of eggs for 1 of embryos. So I could get 10 eggs out of your body and make them into embryos and no. And if you're trying to get pregnant now, that's what we should do, because I want to get you pregnant. But if pregnancy is still remote, for the same amount of money, I could get 2 rounds of eggs, not make them into embryos, have 20 eggs in the freezer instead of just whatever embryos were made from our 10. And maybe I don't exactly know, but it might give me a higher probability for now. And then we make them into embryos as we get closer to that point when we're ready, or our relationship is in a place where I know this is my person for sure. And I think what you're hearing is it's really a complicated decision that the world tries to simplify. I caution every woman that if a doctor is telling you in today's day of the world that you must fertilize your eggs with sperm, that is a red flag for me. I'm not going to say it's 100% false, but it is not reflective of best egg freezing practices. And if you are looking to get pregnant now and wanting to use a sperm donor, that could be a different scenario. But if your goal is to try to keep your door open to have your own genetic child that you are not ready to have, I have a really hard time believing that we should be spending the extra money to make them into embryos with a sperm source that you're not really wanting to make them into embryos with.
That's so interesting, everything you've raised there. And I think I think what's really striking me is just in the time that I've had my children, my youngest is 13, just how much things have changed, right? Because it's almost massively. I mean, I think, if all this had been available, maybe actually it wouldn't have been this so scary, the thought of what if I couldn't have a child, right? Because it seems like actually a little bit like investing in, as you were, using the association earlier of like investing in funds and things like that. Actually, you can make decisions that really safeguard your future goals in terms of having a family, right? And your potential to have it, which is very comforting, I think, for many women who want to go after their career or maybe haven't met the right partner.
I was just going to say absolutely. And I was going to give the qualification that sometimes people like you and I, who maybe had our journey a significant time ago, might try to give advice to women now based on our own experience. But just a word of caution that technology has changed. And so if somebody's telling you, oh, well, my doctor said such and such, always take it with a grain of salt based on the time frame they went through this, because this is an exciting thing about the fertility field, is that we are a very technology advanced field and things are changing quickly. That can be good and bad, but I think from a patient standpoint, it's only getting better and helping people have more families. And so I think, just make sure that somebody who's giving you advice is doing so with the latest data in mind.
Yeah, 100%, because it's changed so much, I guess, like many things. When we look at then, let's say we've got a couple, because what I find is there's never going to be a right time to start a family, right? It's never going to be everything's all my ducks are in a row. And so if someone's looking at it, maybe they've hit 40, early 40s, they're with a partner, maybe similar age, could be older. At what point is there a sort of cutoff where it's like actually the woman's body, if you think like naturally we go through menopause, right, around sort of approximate age of 50, should you be thinking, actually, my body's getting older? Does that start to reduce the chance of a successful pregnancy, even if, for example, we have embryos or we have eggs?
Yeah, this is a great question. And there's two parts I want to answer here. Is that many women falsely believe that the rate limiting step to getting pregnant will be running out of eggs. But for the vast majority of women, the rate limiting step to getting pregnant as we get older is actually the quality of the eggs. So the genetic normalcy or the health of the eggs, the metabolic health of the eggs. And this becomes harder as you're older. And we do see a substantial drop off at age 38 and beyond, where the monthly chance of getting pregnant, if you're just trying for the first time, is going to be 5% or less per month if you are 38 or older. Now, those numbers are not zero, but they are substantially lower than they were in your earlier years. And this is important, one, because you can't change your age, but you should be aware of it. You should be focusing on metabolic health. So, how are you decreasing inflammation and living your healthiest life so that you can do what you can? And then more awareness, earlier cycle tracking, earlier fertility testing. And for women who are 40 and older, if you want to be pregnant for the first time, I recommend you go see a fertility doctor right away. That doesn't mean you have to do IVF right away, but get testing done first, because we do know that you have a lower odds per month and you deserve to not find out 6 months into this adventure that your partner has extremely low sperm counts, needs some medication, is going to be on that for 6 months before we can see a benefit. So I think the earlier you know things, the better, the longer you wait or the older you are when you're trying. As far as does the uterus have an expiration date, which I think is part of the bigger question you're asking here. As women get older, we do see an increased rate of pregnancy complications. A lot of these are due to the placenta. If we think about the placenta, it's the most fascinating organ in the body. If you ever get pregnant, it is growing into the uterus and developing this connection. But the uterine vasculature does matter to achieve this connection. So a lot of these risks are things like preeclampsia, gestational diabetes, small for gestational age babies, preterm birth, higher rate of C-section. These do get higher as you get older, but if you're overall healthy, these risks are going to be less. For women who are age 45 and older is when you start to statistically see the biggest difference. For the most part, fertility clinics who are helping women get pregnant in this age range, often women are using eggs or embryos they made at an earlier age, or they're using donor eggs or donor embryos. Most clinics require these women to get like a cardiac evaluation, a stress test first, a bigger evaluation of their overall health to make sure that we're mitigating risk when possible. And most clinics do have an upper age cutoff of when they won't do embryo transfers due to some of these risks to maternal health. That is typically somewhere between age 50 to 55, depending on the clinic or, the area or what their testing paradigm is. So I think we all do have a moment where our fertility is going to shut off. Stratifying the risk to you personally, will depend on your scenario. Often women are willing to take a bigger risk for their first child. If you have babies at home, though, sometimes we view this through a different lens. And this is why some women who are older might choose to utilize gestational carriers or depending on complications they may have had in their pregnancy. So I think the thing that you're hearing over and over again is that there's a set of guidelines, but very few hard and fast rules, and that there's so much personalization that needs to happen when it comes to charting out your best path about growing your goal family, when you should start trying, what the upper age limit of normal, should be. But even when percentages are very low, a mentor of mine once said, and it's always very profound, is that when it comes to having a child, it's either 0% or 100%. So I could tell you, Angela, you have a 3% chance of getting pregnant doing XYZ. Some of those people will get pregnant, right? 3% is not zero, especially when we look at population based numbers of how many millions of women there are. So we have to keep things in perspective. And those odds rates, even when they seem low, are to help us make the best decisions that we can, but they are rarely all or nothing.
If you're enjoying this episode, I'd love to invite you into something that keeps the momentum going. Every Sunday, I send out Fresh Start, a short, uplifting newsletter that helps you level up your health, hormones, and performance for the week ahead. It's inspired by research from Katie Milkman, showing that fresh starts, like a birthday, a new month, or even the start of a new week, are powerful moments to build habits that last. That's why I created Fresh Start, to give you that opportunity to level up every single week. And inside, you'll find simple science-backed tips that make it easy to take action without the overwhelm. Think of it as your Sunday ritual, a fresh start straight to your inbox. And it's completely free. Just click the link in the description and sign up so that next Sunday, your fresh start will be waiting for you. Such a great point. I guess the other question here is the psychology of it all, right? Which I think is the hard thing, right? It's I remember fortunately I had mine relatively young, but I remember that whole thing, right? It's like when your friends start getting married, and then when your friends start having children, and women can start to feel outside of it, almost like there's this sort of club, and that plays. Then maybe they've even got in-laws, for example, who are very like motivated by whether they're going to see grandchildren. And I feel like this places women under so much pressure, and they feel it more than men. They can also feel, self-conscious around, like, should I tell people that, one of the things is like, when people ask me, why am I not drinking, for example? Now, less people drink these days, so it's not as obvious. But previously it would be like, are you trying to get pregnant? And you would feel it was obvious. And I think that sometimes can impede those goals, because actually the more pressure a woman feels, it can kind of sometimes inhibit it a little bit. I'd love to hear, from having worked with so many women, Dr. Crawford, what you found around the psychology of how women approach it, and this concept of sharing or not sharing your fertility goals.
Oh, this is such a personally and professionally deep topic. I went through multiple pregnancy losses myself. So even going through it, I remember feeling isolated, watching my friends and family get to life stages that I wanted to, feeling triggered at holidays. And it is such an isolating and really emotionally difficult experience. And we know that emotional distress is the top reason why people drop out of fertility treatments who otherwise could keep going or have success. In addition, it's an extremely stressful life experience. It's been likened to a traumatic experience, post-traumatic stress syndrome, or even similar to like how a cancer diagnosis can feel to somebody. So going through infertility is a profound loss, the emotional stress that it can cause, and then ultimately physically what that can do to your body can't be minimized. I didn't tell anybody when I had my own pregnancy losses, and I really just didn't feel comfortable sharing. It was an older time period. A lot of it, what you said, the not drinking, the kind of being called out and then struggling. But I really mentally got to a place when I had my third pregnancy loss, for example. How was I going to call somebody and say, I'm really struggling? I've lost another pregnancy, when I didn't tell them about the other ones. And it really worsened the isolation of the process. What I recommend to my patients now is say, hey, this is going to be an emotionally stressful time. And to build resilience, we have to prepare for it. So whether that means, therapist, counselor, friends, other stress management, acupuncture, yoga, walks, meditation, mindfulness, there's a lot we can do to preemptively build our plate that we should consider. I also think it's really important to tell the people in your world who would show up for you what you're going through. I don't think that means you have to tell everybody. So many women are sharing their fertility journey in real time. And I have to say, I'm so proud and inspired by them. That level of vulnerability I could not have done. And it's really impactful to lessen the stigma and improve awareness. But by no means do you have to do that to share. I think what we find is when we do let people in, they often surprise us in the best ways, whether it's your coworker and you say, hey, I'm going to be missing some things because I'm going through IVF right now. That allows them the opportunity to step up and cover that presentation, help out with the project. You're not having to balance as much on your own. If you tell your best friend, there might be ways that they can support you, whether it's driving you to an appointment, distracting you during the 2-week wait, showing up to your house. One of the most important things we can do to our friends who are going through this is not avoid them, to be a sounding board for them. And I think if your friend is going through infertility or your coworker, it's really hard to say, hey, Let me know how I can support you. I mean, that sounds great, but that puts the burden on the person going through the emotional situation to think of a way to ask you to help. And instead, make it easy for somebody to say yes to you. Say, oh, I would love to bring dinner to your house. Can I bring, you know, pasta on Tuesday? Or I'm available in the mornings if you need somebody to drive you to an appointment or answer questions. Like, please just let me know if your partner can't make it. Or after your IUI, I'd love to take you out for coffee one day and just, hear about how things are going. So try to give somebody, if you're on the friend end and somebody does open up this vulnerability to you, say, even if you don't know what to say, I think the easiest thing to say is, thank you so much for sharing that with me. If this was not your experience or you don't know anything about infertility, you can say, I don't know what you're going through, but I'm here for you and I'm glad you shared, right? Just acknowledging that it is hard is very impactful. And then if you have the ability, like offer to help in a way that's very obvious. It's a distinct thing, and make it easier for somebody to say yes to, because it is really hard whenever you're going through something that is grief or emotionally distressing and somebody says, let me know how I can help. It's really hard to know what to say to that. What's too big of an ask? What can they do? What can't they do? So kind of to flip your question, it's hard on one end to go through it. I told nobody. I regret that. I wish I had told some people in my world who I knew would have shown up earlier if I had let them know what was happening. And that's what I encourage my patients to do. I say, hey, tell the people in your world who are closest to you, let them show up and support you, because I know your people want to show up for you.
That's such a beautiful thing. Like, yeah, and just putting that friend, just taking that step, right, of actually offering something. I think it's so important. Um, Before we kind of close, I would like to just touch with you on ovarian aging, because this is also quite an interesting area, right? There's so much research at the moment, and the idea behind actually almost delaying menopause seems to be more pro women's health. I'm not sure kind of we're physically there yet in terms of our ability to do it. Can you walk us through what happens with ovarian aging and how much control we have over that process?
This was a great question. And we also have what we know and what we can hypothesize. So I think we have to kind of distinguish the two in the same sentence. But I will say this: this is the area of research that I'm most fascinated about. And I think we are going to see a lot of change in the next 5 years. In general, every single woman will reach a point where your ovary is out of eggs. And when this happens, your brain is sending out all the FSH it has, and the ovary will not respond. So you become an ovarian failure. This is a naturally, now you're low estrogen because the ovary makes estrogen in addition to other hormones. And this can have other health consequences. We know the earlier you go through menopause, the higher your risk of certain long-term health consequences can be, like heart disease, stroke, osteoporosis. And delaying menopause can improve long-term health outcomes, just naturally, people who go through menopause later versus earlier. I just got back from American Society for Reproductive Medicine, which is the big fertility conference every year. And this is some of the most interesting research that's going on. How are we going to potentially delay ovarian aging? And there's two ways to look at it. Some people are looking at it so that you can get pregnant later. So that, hey, if we can have the ovary have an extended lifespan, might you be able to overcome some age-related fertility? Now, that is a little bit more complicated question, because we know inside each egg, your chromosomes are held in a certain stage of cell division. And the egg also has the mitochondria that gets passed on to the embryo. So when I said the metabolic health of the egg is also associated with inflammation and wear and tear, that we can modify by certain factors. But for everybody, your chromosomes held in this stage of cell division, they do start to kind of move around the longer you're in your body. So women who ovulate at 25 tend to have more stable chromosomes than women who ovulate at 45. And if we're trying to preserve ovarian longevity for the purpose of getting pregnant later, some of the goal has to be, can we mitigate some of this age-related chromosome damage? That's a harder question to answer than to say, is there a way to slow down this rate of decline so that the ovary will still function, right? When it comes to hormonally function. And that allows us to maybe say it doesn't necessarily matter if the eggs are genetically normal, as long as they are functioning and they are growing, you're ovulating, you're making estrogen. So there's two angles where people are looking at this. They're looking at taking out pieces of the ovary, saving eggs, transpositioning them back in your body. So there's one study going on where they're actually taking some of the eggs out when you're younger and freezing them. And then as you start to go through menopause, implanting them under your skin, like in your arm, because you don't need to get pregnant from them. And then they're able to make fascinating, right? So
Really
very,
fascinating.
very preliminary research. Some of this has been done in cancer patients, right, as a way to preserve their fertility, and now kind of extending into the expanding your ovarian longevity from a hormonal perspective. A side note, for fertility, they've done this for cancer patients, and then they can still stimulate them like you would for IVF. And instead of doing an egg retrieval vaginally, you're able to just go in the arm where they wild.
It's
So
just like mind blowing.
so very interesting, right? And then there's also, looking at different medications and what pharmacology might we have that can essentially, if we think very physiologically, if every month you have a group of eggs coming out of the vault, can I slow down that process? Can fewer eggs come out of the vault? Can I hold them in your vault? One misconception people have is, oh, if I am on birth control, I'm not ovulating, so am I storing more eggs? And that answer is no. Right now, eggs come out of your vault every single month, regardless of if you ovulate or what happens. You lose eggs before your first period begins. You lose eggs even if you're on contraception, even when you're pregnant, even when you're postpartum. You're constantly losing eggs. We don't have a way to change that process. But if we could, that would be an opportunity to potentially, hey, if we can slow this down, can we extend this lifespan? I will say at the moment, this is all experimental, very exciting. We will have more data on it soon. Right. What can women do though? Because if we want to go through menopause later because it's better for your health, what we do know is that women who have insulin resistance and chronic inflammation, autoimmune disease, inflammatory disorder, they run out of eggs earlier. They have a higher rate of what we call low ovarian reserve, and they go into menopause earlier. So, this means that looking more proactively at our health and working to decrease inflammation, working to decrease insulin resistance, should be started earlier in our life if we want to have the longest ovarian lifespan possible. And that end isn't proven. There's no study that says if you eat anti inflammatory, you'll go into menopause later. But we do know that having higher levels of chronic inflammation is associated with a lower egg count per age. And so it correlates to me in my brain that what can you do right now is prioritize everything that we know is healthy, right? If you smoke cigarettes, very inflammatory, you go into early menopause. That is well demonstrated and known. And so this is through an inflammatory mechanism of egg destruction. So avoid toxins, eat lots of fruits and vegetables and high fiber diet, avoid the ultra processed foods and added and artificial sugar. Get enough sleep. That's when your body heals from inflammation. Build and use skeletal muscle that helps fight insulin resistance, which is a huge factor when it comes to chronic inflammation. And figure out how to manage your stress, as we mentioned earlier. That's what women should focus on, regardless of if they want to be pregnant or not, if we want to try to preserve our ovarian function as long as possible. And I think that we will see new and exciting developments in this field. But right now, stopping any of the additional inflammation that we're exposed to should be our primary goal to improve our hormonal health and our ovarian longevity.
So it's the same things actually for the work for fertility that will also reduce inflammation and aging, right, and preserve.
It makes sense, right? Your body's all connected. We're really talking about cellular health here. So it's not, oh, do this to get pregnant, then do this to have your ovaries work longer, and then do this to have success in perimenopause. It's the same thing. It is all looking at decreasing inflammation, decreasing insulin resistance, and building up resilience inside your cellular health.
Amazing. That is so helpful. Is there anything that we haven't spoken about that you would really like women to know, Dr. Crawford?
I mean, there is so much we haven't spoken about that we could talk for hours. I think the biggest thing is this. At the end of the day, we will all go through menopause, right? We will all have limited time when we have to grow our family if fertility is a goal. It is nobody's story but your own. There is nobody to be an advocate for your health but yourself. In order to advocate, we can't just rely on luck. We want to learn about our body. We want to know what's normal so we can get answers when things are not normal. And we want to know that we're making the best decisions with the data that we have. And hopefully, conversations like this are bringing that to the forefront so people can learn more about this.
Yeah, so much. And just, I'm so grateful to you and so many other of the female health doctors, that are really bringing this conversation to the fore, because it's just, I've learned a ton just listening to you. Yeah, just so much, and how things are moving so quickly. And I just think it's really promising for women, right? I have a daughter and I look and I think actually there's very real opportunities for her to build her career without so much worry, because now we have these technologies and things, and women hopefully don't feel so pressured and they can take care of their health, and it gives them choices. So thank you so much for coming on today and sharing all this. It's been absolutely amazing. Please share, how can people connect with you and your work?
Absolutely. Thank you so, so much for having me. I do have to say my debut book, The Fertility Formula, is coming out, and you can pre-order it right now, which goes into everything we talked about in more detail at nataliecrawfordmd.com/book, or anywhere where books are found. I'm also on Instagram at Natalie Crawford MD and YouTube. And then I host the As a Woman podcast. So look forward to hopefully connecting with more of your audience. And thank you for having me, Angela.
Amazing. Thank you so much. We will link to all of that in the show notes. When is the book out?
April 14th is when it will be in print.
Amazing. Amazing. Thank you so much.
Thank you.